Hi, today we're going to perform a wound dressing change. First, what we would do is provide privacy for our patient, and then we would perform hand hygiene. Next, we would make sure to gather all of our supplies and equipment that we're going to need for today. We would verify the provider's orders for the procedure as well. We'll introduce ourselves to our patient, and then we'll get the patient's two identifying factors, their name and their birth date. We'll explain the procedure to the patient, and then we'll assess the patient's pain status as well. Next, we're going to apply a gown, goggles, and a mask. This is for the risk of spray whenever we're performing our procedure. Okay. Next, we're going to position the patient in a comfortable position, which the patient is in already. We're going to put a waterproof pad underneath the patient's leg where the wound is. This is to avoid whenever we're irrigating the wound. And we'll make sure to just keep the area uncovered that we're working with today. Next, we're going to also instruct the patient not to touch the wound or any sterile supplies. Next, we're going to place a biohazard bag within reach of our work area and then fold the top of the bag to make a cup. Okay, next, we're going to apply some clean disposable gloves. Next, we're going to remove the tape. We're going to pull parallel to the skin towards the dressing, holding down the uninjured skin, and we're going to pull in the direction of the hair growth. And if necessary, we can get the patient's permission to clip or shave the area and remove any adhesive from the skin. And with a clean or gloved hand, or forceps, we can remove the old dressing one layer at a time. And while we're doing that, we can observe the drainage, and then we can discard outside dressing first. And we do this carefully and slowly to avoid placing tension on the drainage devices if the patient did have any. And we'll keep the soiled underside of the dressing outside the patient's site. And then we'll fold the dressing so that the drainage is contained inside of it, and then we'll remove our gloves inside out. But if the dressing was small enough, we can pull one of our gloves inside out over the dressing. And we'll dispose of our gloves and soiled dressings in our biohazard bag, and then we'll perform hand hygiene, which we just did, and then we'll apply a pair of new clean gloves. Next, we're going to inspect the color and the integrity of the wound. We're going to look for edema, which is swelling, and then we're going to look for exudate, which is drainage, and any loss of skin integrity. And then we're going to observe the skin around any drainage devices if the patient did have any. We're going to also assess for any odors. And then next, we're going to remove our gloves again, and then we're going to perform hand hygiene as well. Put our gloves in there, and then perform hand hygiene. Okay, now we're going to apply sterile gloves. And what we would do if this was a scenario, a a real scenario, we would make sure that these are on a table outside of the area where the patient is. So we're going to act like this is a table outside of where the patient is. Then we're going to apply our sterile gloves. Then we'll discard our wrapper. Okay. Next, we're going to gently palpate the edges of the wound. And this is to determine whether the patient's pain has increased and to assess the drainage and the bogginess. And then we would measure the length, width, and the depth of the wound if it was indicated that we needed to. Next, we'll dispose of our gloves again. Dispose them in our biohazard bag, and then we perform hand hygiene as well. Now we're going to create a sterile field on our overhead table using a sterile dressing tray, or we could also use individual wrap sterile supplies as well. We'll apply sterile gloves, or we could use clean gloves and use sterile forceps for a non-touch technique, depending on the status of the wound. So what we're going to use is we're going to just use clean gloves, and we'll use sterile forceps. And these are our sterile forceps. So we're going to cleanse the wound. This is all sterile. So now we're going to cleanse the wound using, we could use antiseptic swabs, or we can use a spray antiseptic like we have here, but we're going to use the antiseptic swabs today. And we do this with a cleansing stroke with each one, going from least contaminated area to the most contaminated area. And we have to discard each one with each stroke. So from the least contaminated to the most contaminated. And if there was a drain present, we would cleanse around it in a circular motion strokes using aseptic technique as well. We would begin near the drain and move outward away from the insertion site. Next, we're going to use dry gauze. So we're going to use our sterile forceps, and we're going to use dry gauze. And we're going to use this to blot the wound, working from least contaminated to most contaminated. So from least contaminated to most contaminated. And if the patient had a drain, we would blot around it in circular strokes as well, beginning near the drain and then move outward away from the insertion site. Then we would apply an antiseptic ointment if it was ordered by the physician, and the same technique used to cleanse the wound as well. We're going to show two types of dressing changes, dressing applications today. First, we're going to do the dry dressing. We would apply loosely woven gauze as the contact layer. And if there was a drain present, we could apply another 4x4 gauze to sit flat around the drain as well. We'll apply additional layers of gauze if needed. And then we would apply a thick woven pad or a Surgi pad or an abdominal dressing as well. Okay, so that was for a dry dressing. Now we're gonna act like we didn't do anything. We're gonna show you how to do a moist to dry dressing. So I'm gonna get rid of all this. We're gonna show you the moist to dry dressing. Okay, so what we would do is we would pour, for the moist to dry dressing, we would pour our sterile solution over a package of the 4x4 gauze or a strip of fine mesh gauze into a container of prescribed sterile solution. Okay, next we'll remove our gloves and we'll perform hand hygiene, and then we'll apply a new pair of sterile gloves because we're going to be on the patient, so we need to use sterile gloves. So we're going to act like we're putting on a new pair of sterile gloves. So we will then wring out the gauze, getting the excess solution, and then we'll apply the moistened fine mesh open weave gauze as a single layer directly onto the surface of the wound. And if the wound was deep, we would use a sterile gloved hand or forceps to gently pack the gauze into the wound until all the wound surfaces are in contact with the moistened gauze. Then we would ensure that the dead space from the sinus tracts, undermining, or tunneling has been loosely packed with gauze. We do not let this gauze touch the skin around the wound. We fill the wound, but avoid packing it too tightly or allowing the gauze to extend beyond the top of the wound. Okay, next we're going to apply a dry, sterile gauze pad over the wet gauze. So we're going to pretend that this is a dry one. We're going to put it over the wet gauze, because I'm still wearing sterile gloves and we have to still keep a sterile field. And then we're going to cover the wound with the ABD pad or Surgi pad or gauze. And then we're going to secure that dressing with a rolled gauze for the circumferential dressing. And then we'll apply with tape, adhesive ties or straps applied perpendicular to the wound or with a binder. And then we'll use a skin protect barrier such as a hydrocolloid before tape or adhesives are applied to sensitive skin if needed. Then we would label our dressing per our facility's practice. Okay, next we're going to remove all of our PPE that we've used today. So we're going to remove our gloves, goggles, making sure that to keep all the soiled part away from us while we take off our gown. I'm going to put it in the biohazard bag. I'll just take off my mask. Then I'm going to perform hand hygiene, and then I'm going to apply a new pair of clean gloves. And we're going to dispose of all of our equipment in the biohazard bag. And then we're gonna take it out of the patient's room because we're done with it for today. And then we're gonna place the patient into a comfortable position with the bed at the lowest setting, and with as many side rails that need to be put up as well for safety. And then we're going to make sure that the call light is in their position for them, within reach for them. We'll remove our gloves, and then we're going to perform hand hygiene, and then we'll document and report the patient's response to the procedure. Thank you very much for your time today.